Hi there. Welcome to The PrevenTable, the podcast giving you a seat at the table with conversations about the intersection of alcohol, drugs, and mental health in everyday lives. Take a seat and join us.
Welcome to The PrevenTable. Before we get started with our guest today, I want to make sure and give a big shout out and thanks to Hubbard Radio for allowing us to share their space and record our podcast so that we're able to have these conversations and share information with all of you listening. Today, I am excited to have a new-ish partner with Prevent+Ed and some work, and we're going to tell you all about some amazing collaboration we have going on. Welcome, Tasha.
Thank you for having me today.
Absolutely. So Tasha is with, let's see if I can get this right. It's a long name and an acronym, and
Big breath.
Here we go. The test. Tasha with the Jefferson Franklin. I already messed it up. Let's try again. Tasha with the Jefferson Franklin Community Action Corporation.
Correct, bingo.
Woo. Otherwise, JFCAC.
Yes.
Okay. Which
JFCAC.
is JFCAC.
We have a lot of nicknames, yeah.
All right. So before, we talk about our collaboration, tell us a little bit about you and JFCAC, JFCAC. Yes.
Yeah. So my name's Tasha Skouby. I'm currently the grant coordinator with Jefferson Franklin Community Action Corporation. I'm born and raised in Franklin County, so that's kind of what drew me to work with the agency, is being able to give back and contribute to programs that benefit my community.
Excellent.
Yeah.
So what are the programs? What does the JFCAC do?
So every county has a community action agency. We kind of facilitate the federal funds that come down for housing, Head Start, LIHEAP, WIC program. We operate that even. And then the program that I'm in is community services. And we're pretty unique in that we really get to hear what the particular needs are in our own community and then customize smaller programs that aren't on that larger federal scale that have very strict guidelines you have to follow.
Yes, federal programs often do have some strict guidelines to follow, which is important. We all need guidelines, and we all, I think, would want our dollars and our tax dollars to make sure they're being monitored and used wisely. Mm-hmm. So, there should be guidelines, but sometimes it's like a lot of hoops to jump through.
Yes. And with me being I enjoy the creative side of hearing from the community and kind of developing those programs. Mm-hmm. And you don't get that kind of creativity with federal funding.
Yeah, with federal, you just have to do A, B, C, and D. Yeah.
Yes.
So excellent. So you really get the chance to work with community members.
I do. Yeah, I started with community action with our Community Trust Project. I was hired on, and that we facilitated community meetings where we brought on everyday residents and taught them and empowered them to lead community meetings and make decisions. And then they all got to implement their own community project, and we provided the $15,000 seed funding for that. It was a temporary project, so I didn't know if I was going to be able to stick around with community action, but thankfully they kept me around. Then I moved into an innovator position, which was being in charge of particular programs, and it was my responsibility then to just make sure that project happened. Grant funding was part of that. And since I did well with that, now I've moved up and doing grant writing for more of the programs, not just those two particular ones that I was in charge of back in 2023. So it's exciting. I get to do a little bit of everything, get to help a lot of the different departments. I don't have to worry about their day-to-day operations, but I get to help lift them up and make their job easier.
That's really cool.
And I love that part.
Yeah, that's probably definitely the fun part. Mm-hmm. So Jefferson County and Franklin County, for people that are listening that may not be familiar, these are two counties just, I would say just outside the larger St. Louis metro area. So some people have referred to them as collar counties. I would say two of the more rural counties within our region here. So thinking about Jefferson and Franklin County and them being a little more on the outskirts of things, a little more rural, what are you finding are some of the biggest needs in those communities? What are the people in the communities sharing with you all that is showing up over and over again?
Well, what we hear from the community matches perfectly what data has been collected with. As a grant writer, that's where my whole world is in. So really, over the past 15 years, transportation, housing, and childcare have continuously been the top three needs. Mm-hmm. And then this year, we're actually is a new project I get to implement is our community needs assessment is this year. So we're getting ready to kick that off, where we get to hear once more what the local needs are now and how we can address that. Based off
If
of
you had,
sorry
to interrupt you, but I was going to say, like, thinking about getting to do a needs assessment, which I would say getting to do too, because I think that, you know, how you said that both of us might be a little on the data nerd side here and like, yay, we get to do a needs assessment. Some people are like, a needs assessment, but it can be very exciting to hear from the community. Do you, you know, again, not to hold you to anything, but do you think that any other major concerns are going to show up outside of housing, transportation, childcare?
You know, those are always the top three. What I'm particularly looking and interested in is kind of our digital literacy piece of it. That is one of the projects that I was overseeing before I came in, and I got to hand that off to our community services department. But digital literacy is something that is very overlooked in the community, I feel like, and I'm interested to be able to gather that data, to be able to tell that story. And that's part of the community needs assessment. Is you look at it and you're thinking, oh, this data, and I have to do all this work to get it, but we get to be the voice of the residents. Like, they're trusting us, they're sharing with us what they need and what's going to make a difference in their life, and then we're responsible for making sure that we represent that need and develop and create those community systems that really help address it for the long term. With transportation, you know, being in a rural community, there is not public transit like there is in St. Louis. So, and since we're in the St. Louis region for funding purposes, we're often overlooked for stuff like that. So kind of recognizing what those needs are and pulling the story from the residents themselves so we can help with fundraising, donations that are coming in, because we can't rely on grants alone.
Right.
And getting that information and that story from the residents is what really makes the difference on whether we just check the box with a federal grant that, you know, it's kind of standard and everyone can get, or we really create impactful programs. Yeah,
and as you know, I'm just connecting some dots in my brain about some things you've just said. I'm thinking even when we're talking about things like transportation or housing or childcare and digital literacy, you know, digital literacy just continues to evolve in our world. And so even things like transportation. Okay, so, you know, I don't know that in the near future of any time, like, we're going to have public bus routes in Jefferson and Franklin County. That might be a lofty goal, but we know that there's other types of transportation, you know, that have rapidly become more and more available in communities when we think about shared rides or things like Uber, Lyfts, etc. But those also have a digital literacy component to them.
Yeah, and that's where we've been able to really kind of bundle those two programs together at Community Action, because we have EZMO Transportation, which just implemented a new rider app. And that's one of the challenges. We want to encourage people to use this app because it's going to make scheduling their ride easier. It's going to make time easier for our staff with having to schedule those rides. But people aren't comfortable with the app. And technology, no matter how good you are on it, it always presents a challenge. And so it really comes to just making sure that individuals get the practice and we help them build the confidence to be able to navigate it. You can't just teach somebody how to work the internet. You have to teach them the skills.
And exactly what they're looking for. So the EZMO program, that's a popular one. Tell us more about what that is.
Yeah, so EZMO Transportation was developed out of a community needs assessment. And it is a volunteer driver program that the volunteer drivers get reimbursed their mileage. They drive their own vehicles. And then we coordinate them to community members that need rides, pretty much. So then the rides are no cost to the residents and people that are qualified for the program by their income eligibility or other factors, depending on what the variety of funding source they're tapping into. And we match them up with the driver. They request their ride through the app. It sends a notification to the driver. They accept it. It has the GPS tracking, gets them to their destination. So we do rides for employment, education, healthcare, like food, access, court cases. We just don't do recreational trips. So you can't go get your hair cut. You can't go to the dispensary. There's different guidelines of what we have related for that. One of the things that I find really unique about it is whenever we implemented it in 2023, it got off the ground. We anticipated medical was going to be the top need because of the community needs assessments in the past. And what we found is almost 70% of the ride requests are for employment.
Really?
Yeah.
Like, And so when you say employment, is that seeking employment or even just getting to
maintaining employment?
Maintaining employment,
yeah. A lot of times there is the few chances of individuals that, they need the ride to the interview. Mm-hmm. So we have a few of those scattered in. But what we've really noticed is that increase of employment rides because it impacts our funding so much. We went into the plan of people would need 4 to 5 medical rides a month versus 4 to 5 employment trips a week.
Well, right. That's what I was going to say. So really, if somebody's on the app, they could, schedule a ride at 8:30 every morning to get to work if that's what their need is?
Yes, they could. Yeah. They have to schedule a ride on their way there, and then they'd have to schedule a separate ride for their trip home.
Okay.
And then rides are never guaranteed because it's volunteer-driven base. Jefferson County is at a little bit of an advantage because there's a higher population. We have more drivers in Jefferson County, where Franklin County is really struggling to see the impact of that program because we don't have nearly as many drivers. Plus, it's more rural than
it is
Franklin
more rural.
County
And
than Jefferson.
Is Franklin County just bigger than Jefferson County?
It is,
too?
yeah.
So it's more rural, probably has a lower population, but it's geography, is that the right word? It has more land. You have to travel more miles to get somewhere, probably.
Yeah. There's more square foot acreage in Franklin County, about half the population. Poverty rate is about the same, so that isn't too different. But really, just the amount of people within the community that can help support individuals is just a lower pot of people that you can pull from.
So, the volunteers are such amazing people and people that just give of themselves. Is it... Tell me about your volunteers. I'm thinking of all the things I could ask. How many do you have? And what kind of people are they? Do they tend to be older, younger? Is there any specific demographic?
There's a wide mix to it. Our very first driver was Taylor Miller, who is also the EZMO coordinator right now. So Taylor was assigned this project, and it was difficult to get it off the ground. So she was flexing her time at work, serving as the first volunteer and kind of proving that this system works.
Yeah, a little proof of concept was needed.
And then it really became word of mouth. Some employees, their family and friends started joining, and then they would share the word. We really did have a pretty heavy recruit focus on church groups.
Oh, makes sense.
But a lot of those individuals, they're already willing to donate their time to give rides. So in order to, register to be a volunteer, and then the compensation with the mileage reimbursement wasn't the incentive for them. So we didn't really get as many of those volunteers as what we had anticipated. But we have ex-law enforcement, single moms that are just, their kids are in school and they're looking for a little bit of extra time during the day. With the mileage reimbursement, it's not profitable, it's not income, but it does help address those small little needs that you have.
Right. So, because I'm assuming it's probably, a reimbursement rate that it's not just covering the gas in your car. It's a reimbursement mileage rate.
They do that standard IRS rate. Yeah, so it goes up with it as it increases.
So, so it does end up, I guess, if you're not considering other factors, you're doing it sometimes a little extra in your pocket.
You're not
maybe.
doing it full time.
Yeah.
These are volunteers that are just giving a couple rides a week.
It's not going to be an income, but it might, just help, like you said, with those little extras.
Yeah. And then we have partnerships with groups like the Developmentally Disabled Advocates DDA. So, we have special funding that secures those particular riders. And then as the riders have different challenges like that, we have the ability to kind of customize and make sure that they're paired with a driver that they trust, that their family can ensure that they're getting to their job safely. So we have that unique ability where other rideshare programs don't have that human-centric connection piece of it.
Which is so important. I mean, we know that relationships are everything. And so Prevent+Ed and you all, I mean, we are at the same tables. We attend a lot of the same community meetings, really looking at, the same goals in communities of helping to create healthier communities. And so, our paths crossed in many ways, and we started talking a little bit about the EZMO program in Franklin County and our work with, our peers and, how there might be some connection there. And then those conversations just kept growing.
They did.
And next, as if you are listening and you remember from previous podcasts, in June, we officially opened a recovery community center, The Collective, in Jefferson County. So it was almost a year ago, maybe 9 months ago or so, I think that you and me and some of my staff, some of your staff were like, we should get together and talk. And as the story goes, and I don't know if I have this right because my brain's not always the best at remembering details, but one of my staff people said, Tasha asked us if we wanted a van.
Yep.
And I said yes. And I said, oh, okay. And then as we started like putting these pieces together, we really thought about how transportation and support in Jefferson County would work. So, you know, like I said, that was my version. And we started talking about this idea that we were coming together and planning of this of the Recovery Community Center and the collective in Jefferson County, and knowing that transportation is still going to be a barrier for people. And then it was just like this gift that you all come in and like, you want a van? And we're like, well, of course we do. So tell us about like how this van idea came together.
Yeah, you guys, we could not have partnered at just the right time for that as well. So with our transportation program, we get state appropriations funding. That is the main backbone of that. We are one of 4 volunteer transportation networks in the state that kind of gather together and receive this funding. What was unique to us was, in addition to that state appropriations funding for the group, our community action agency was earmarked for money to purchase a van to support microtransit. Yeah. But we don't implement vans. You know, our drivers have their own vehicles. So it was really shocking to us of how we got this award. But of course, if you want to give it to us, we can more than certainly use it. And we have the resources and the connections to make sure that it's going to get used for microtransit transportation. So we've been in communications with Prevent+Ed, especially out in Franklin County, with how we can expand our volunteer driver network out there. We're getting more drivers on board. And Prevent+Ed was always interested in, you know, having a partnership with that. We just didn't really know how to connect those dots. And whenever the van came through, I was like, you know, we don't have a lot of Prevent+Ed volunteers, but is there a way that we could partner up so you guys could use this van for your services, and then we collect the data on it to be able to tell the story back to the state, which is amazing right now because for substance use, we haven't had a lot of been able to collect a lot of data on that. That's not one of the intake questions that we ask. Right. But the future of Missouri's funding does support transportation for recovery. So this information that we're able to gather from Prevent+Ed is only going to be able to further enhance that story that Missouri state legislators are going to get on how we can further that support and why we need more money to address more transportation. Because that's something no matter how many volunteers we have, how much money we have, there's always going to be somebody who needs a ride, and we just don't have the capacity to make it.
Right. Well,
so
of course.
It takes partners like that.
And, you know, and it's like such a no-brainer moment, right? Because when we're talking about transportation for people in recovery. So when we were even, you know, having those initial conversations and sharing about the collective and what a recovery community center really is and how it's a place where people can come and get connected to substance use services, but it's also all of the other services that are already needing connection. Employment, housing, other social services, medical appointments. You know, when we're thinking about people that are needing support for substance use and recovery, there are people that need support. And so, you know,
stable housing and stable employment, it really contributes to how well that you're able to succeed in life.
Absolutely.
And that's what I think is beautiful about our partnership is because while our focus is not on prevention and support really go hand in hand to lifting up the community. And
so this isn't just like, oh, well, people need a ride to treatment. Well, yes, some people do, and that's important too. I mean, if you don't have a ride and you need a ride, that's a piece of it. But it's really such a little piece. Sometimes people just need those other supports, and I think that's really important. Or, you know, our staff have also been able to help connect transportation services for people that are looking to get to the collective and are looking to, you know, well, maybe even just take that first step on this journey, but first you have to get there, right? And so it just is supporting people in ways that we didn't even know were possible. That, again, just the word collaboration. And I said this, we did a official key handoff and celebration at the end of June. And I think I said some of this there, but the word collaboration is feels like such a buzzword in today's world. Like, we talk about collaborations. Everyone's like, how can we collaborate? Let's collaborate. And to me, there's different levels of that, right? Like, there's places where we can collaborate because we network and I know what you're doing and you know what I'm doing, and we'll bounce ideas back and forth. There's times when we just might, have, a meeting that we attend together or something like that. But this partnership between our two agencies is really the true definition of collaboration. We're taking different missions and pulling out those similar components of them and coming together and doing this project to support both of our efforts.
Yes.
And that's what collaboration really is.
Yes. Yeah, we're really providing a network around those individuals to help them out, to know that they're not alone, and even with our volunteer drivers, that's kind of what I find unique about it. Is not saying that paid employed drivers don't give that same kind of attention, but our drivers really get to serve as a mentor to these individuals.
Absolutely.
Just like with the peer support specialists, whenever they're going through something, they have to go to a hospital visit because of a family member. We've had drivers that have went on their own personal time to make sure that individual is eating lunch while they're sitting up there at the hospital. So you get those really compassionate human side of the stories to show that individuals really do care about you. They may not know your whole story. They may not be able to help you with exactly what you need at that moment, but they're supporting you and lifting you up throughout that.
It is really a beautiful thing. And so, we've been so fortunate to have this partnership and, receive the van, and then really building this transportation program as part of the collective. So, it's almost like a mini program within a program, but it's important. And I think, like you said, it is about that connection and just those layers of ways that we can really help people. I think it's amazing. It really is. And we are so grateful and thankful. I mean, we know in most communities, whenever we're talking about any health concern, behavioral health concern, just needs in the community, transportation is way up at the top of that list. And to know that, we can take something that is such a challenge in communities and we can find solutions.
Yes.
We didn't start a bus line in Jefferson County. Like, we're not saying that we're going to have to overhaul and do everything, but we just said, well, we can just start here.
Exactly.
And do what we can do for now and see how it works and gather some data and have some information and then hopefully be able to expand that in Jefferson County and other communities.
Yeah.
It could be really cool.
Yeah, it'll be really interesting to see where EZMO Transportation as a program goes because they have ambitions well beyond just providing rides.
Oh, yeah.
So, the goal is to be able to address transportation needs at every level. Just providing the rides was a good start and ensuring that the low-income individuals remain involved. A lot of times with, even with public transportation, it might be a small cost to it, but especially with Uber or Lyft, that is so expensive. Our individuals, even if it is available in your community, those individuals that are living on a fixed income, the elderly, they're not able
it's
to
still not
access
accessible
that.
For them. Yeah.
So that's been the big key takeaway from this program is we make sure that we're really going after those that aren't able to access what little resources there are in the community.
So if somebody listening is wanting to know more about the Jefferson Franklin Community Action Corporation or the EZMO program, maybe they want to be a volunteer driver, or maybe they're looking to connect someone with the resources for transportation, what's the best way to connect with you all?
The best way to connect is going to be online. Everything is moving to a digital world now. Our website is www.jfcac.org. You can type in community action in your Google search, and it'll bring you whatever community action agencies in your community. I mean, if you live in Jefferson and Franklin, you're just going to get directed to us.
That's awesome.
Yeah.
Well, thank you. And thank you for working with an organization that is doing so much to help the community. Thank you for your partnership. Thank you for joining me today on the podcast. It's been really fun to hear more about all of the programs.
Yeah, thank you for having me. I'm so grateful that I've been able to go in this position and be able to speak on behalf of Franklin County.
Yes. Awesome. Well, thank you all for listening. I hope that you all are able to connect more with JFCAC or the Jefferson Franklin Community Action Corporation. I think I have it down now, and it'll be ingrained in my brain too. Thank you to Hubbard again for allowing us to record in your studios. If you've liked what you've heard and you want to hear more, please like or subscribe to anywhere where you get your podcast. We'll see you at the next episode of The PrevenTable.
Thanks for joining us at The PrevenTable, brought to you ad-free by Prevent+Ed. Prevent+Ed works to reduce or prevent the harms of alcohol and other drug use through education, intervention, and advocacy. Please visit their website at PreventEd.org. Like what you heard? Rate, review, and subscribe to stay up to date with what we are serving on The PrevenTable.